Hi there, I've been asked some advice about a 12-year-old's aches and pains in their legs. This is a video to explain what's going on, which may be of help to you. Now you should just be able to see my leg and the foot. What I'm going to do is explain what tends to happen with youngsters who are around about that kind of adolescent age. We get this growth spurt. The bones grow faster than the muscles. The muscles get tight in the legs, and so what we have is a situation where the movement has to come from somewhere. So if we want to get our knee over the foot, that movement obviously is a key part of normal walking and activity. Movement happens at the point of least resistance, which means the stiffest bits don't allow the movement, and the least stiffest bits do allow the movement. Now in this case, we have stiffness at the back of the calf, and that means that the movement has to come from somewhere else, and it comes from the mid part of the foot. The mid part of the foot is, in this case, less stiff than the calf muscle. So as we move forward, we get a collapsing of the arch to the inside, which then allows that movement to take place, and we can propel ourselves forward. Now in an ideal situation, we have a good length calf, and that allows that movement to proceed forwards over the foot without the foot going to the inside. So this pattern results in misalignment higher up the chain, which of course can lead to aches and pains, particularly around the knee, the hip and the lower back. So in order to correct this, what we need to do is do a few things in terms of strengthening and stretching. We need to stretch the calf muscle, we need to strengthen the hip muscle, and also it can be a good idea in this instance to correct the arch with an insole, simple over-the-counter insole that can help support that inside arch and encourage good quality movement. It is not a disaster to have this sort of problem. It's very, very common at this sort of age, but actually getting on top of it now can be really, really good in terms of the future. What we don't want to do is just whack an insole in there straight away without the flexibility of the calf and then cause more pain because the calf has not caught up. We want to get some better mobility through the calf in terms of stretches and control the inside arch. So I'll show you a few exercises which can do just that. And this is my son Ben, who's had medial arch problems, and he is going up and down on his tiptoes, just slightly pointing the heels inwards, and we do it 10 times. Standing, increasing the arches 10 times, which exercises the muscle tibialis posterior. Stretching the calf, very, very important. Stretching the gastroc muscle first of all with the legs straight back behind. Very important that the feet are facing forwards and not facing out to the side. And we also want to stretch the soleus muscle by bending both knees. There'll be less of a feel of stretch with this, but it's still good nevertheless. All the time keeping the feet parallel facing forwards. 3 times 10-second holds. Clam exercise to strengthen the gluteus medius, the hip muscle on the side, 10 times. And single leg dips, keeping the knee in alignment over the foot 10 times. So a question is often asked in this instance when I recommend insoles is, should you put the insole in straight away and how much? Well, I would suggest that you did some stretches for a few days, maybe 4 or 5 days of doing the calf stretches and the exercises, and then put the insole in, start to wean the insole in. So don't get them to wear it all the time, but maybe half a day or a few hours at a time, and making sure that the body has a chance to adapt to its new form of movement. And then you can gradually increase that to the point where they're actually using it all the time. Continuing to do the stretches, of course, at the same time. So I hope that's useful to you. If you have any questions, please get in touch. I'm happy to help.